Okay, welcome everybody. Let's go ahead and get started. I'm really pleased to be able to be here with school and HSC campus today, and for our community that couldn't be here but is online. We will have the ability. I'll give a few remarks, but I want to leave some time for Q&A because obviously I can't touch every topic that's top of mind to everyone. But certainly would welcome an engaging discussion as we finish up. For those who are online, they can certainly place a question in the chat. We'll have someone monitoring the chat and they can relay those questions to me, and I'll do my very best to address questions or comments or issues. So I want to thank you for joining us. I want to thank this community. The School of Medicine, as I've often said, is not just brick and mortars, but I want to thank you for everything that you do as far as our learners, our faculty, and staff. I thank you for every lecture taught, for every patient served, every experiment conducted, every grant submitted, every learner supported, and the collective effort and powers that you bring to bear for our institution throughout the Commonwealth of Kentucky, the region, and the nation. The faculty and staff are the backbone and really the sinew and the nervous system that keeps our community working and vibrant, and I never lose sight of that, and I'm very grateful for all of you. I'd like to start with just some reflections on where we're at, kind of in our current state, and then I'll discuss some of the challenges we're facing, some of the opportunities that we're seeing, and then, as I said, I'd love to have some engagement with the audience. As you know, we are more than just a medical school. We are a powerful community, and I thank the people who contribute to that, but I really want to look and think about our people a little bit. And let's think of it just by the numbers right now, briefly. You can see that we have over 117 divisions, 23 departments, 21 centers and institutes, and 8 decanal offices. And this proposition really hosts and attributes itself to be leveraged to the needs of a huge, huge population of learners. And as you can see here, over 660 professional students, 650 residents, 283 graduate students on this campus, 189 fellows, and 135 PhD candidates. So it's really a very big ecosystem of learners that is beyond just what we traditionally think about in a medical school. And then if I think about our workforce, we have well over 3,000 people if you look at staff, gratis faculty, and faculty. And many of our gratis faculty really play a fundamental role, particularly around our health system and our health system's development and engagement for access in the region, but also for experiential learning that occurs throughout the Commonwealth of Kentucky, including the AHEC program and many other very important programs that affect the university. What we're trying to leverage even more is our network, both inside and outside of the university. And if you look at this, at least an alumni base of 11,923, and that's existing. So we're trying to broaden that base to include our resident and fellow graduates and alumni, and especially our alumni too of our graduate school, because that's a community that hasn't been as well attended to and connected with as much. We want to be able to do that to leverage it not only for philanthropy, but probably more importantly to engage for their experience and their input and their engagement in teaching and meeting our learners, discussing our programs, and actually becoming advocates for the program beyond our walls. We have over 181 endowed professors and currently over 8,203 unique donors. We have the highest philanthropy goals and the highest level of philanthropy of the schools in the University of Louisville, and we want to continue to keep that strong. And you'll see the reason that there's quite a bit of a focus of my time that's going to be diverted into philanthropy over the next few years because we have some really ambitious proposals before us and some compelling needs before us that's going to require increasing amounts of my attention. I want to talk about this kind of in a pillar-like way around our work, and I'll talk a little bit about some of the things I'm very proud of. Certainly, this is not an exhaustive list, and there are many things that I'm proud of far beyond this list, and if I excluded things, please don't be offended by that, because I do recognize the amazing amount of work that goes on in this university and school in all of our mission pillars. Some of the things, though, I think recently that I would make you aware of if you are not aware of is that we're really redefining student success, for example. We have increased our medical school class, and yesterday we had the white coat ceremony for a class of over 175 entering M1 students. That's the peak of our accreditation amount. Certainly, if we wanted to train more than that to address the healthcare workforce shortage for physicians, we would have to begin to amplify the size of our facilities, the size and capacity of our faculty. So we think growth beyond that 175 point will require considerable thoughtfulness around resourcing additional students and additional programs. But certainly that's going to be an area of focus. The legislature and in this region, we definitely need doctors. You've heard me before refer to the fact that 107 of Kentucky's 120 counties are health profession shortage areas. So we are in an area where there is a disproportionate fewer number of physicians, both in primary care and in specialties increasingly. So our ability to make impact on that is going to be a center of our focus because there is considerable amount of, I would say, both opportunity and pressure regarding this because the state has that expectation. Increasingly, the federal government and other governmental entities have that pressure, but they're also willing to place resources around that. And we have to think of how we integrate and obtain those resources in an effective way that helps us meet mission and meet it successfully while maintaining quality in our programs. We additionally have a graduate student increase. We've increased the stipends for our graduate students in the PhD and some new master's programs in the school, and we want to keep those strong and competitive with the market. We now have the 1837 Society, which was the year of the founding of the medical school, and that society has been deeply engaged and very active. Not only have they been individuals who have given their time, talent, and treasure, at least $10,000 or more a piece to the school, they have now established a society endowed scholarship fund, understanding that, as we'll talk about later in greater detail, that unmet financial need of medical students and graduate students and probably students across the board in public universities is something that we cannot ignore going forward. Additionally, in the national rankings, a couple of them here, I didn't list all of them, but certainly in the most recent U.S. News and World Report, the Madison Regional Campus had a national ranking of 4th out of all the regional campuses, which is a consortium of about 40 to 50 rural medical campuses. We were number 34 in most graduates practicing in rural areas. This is of about 180 schools, 155 which are LCME accredited medical schools, the remainder of which, the balance, is largely osteopathic schools. Number 53 in the most graduates practicing in health profession shortage areas, and number 83 with the most graduates practicing in primary care. So those are points of pride. But as a publicly engaged university that is really concerned with the workforce, we are also an R1 university. So we do have to think about research and how we are ranking in research. And most of you know that we made a movement in the Bremer rankings this past year from being 75th to 71st. So in the headwinds of federal research, we have still been able to compete effectively and thoughtfully. There are also concerns that still persist in the research world, and we'll talk about that a little bit when we talk about challenges. I'm very excited, though, about many of the things we're doing in research, and you can see that we have over almost 600 active projects, 205 new grants, 415 non-federal grants, and $48.7 million of federal NIH funding. It's been a very strong portfolio that continues to strengthen and get stronger, and hopefully we will be able to continue to do that in what's been somewhat of a turbulent environment in federal funding. A total of $103 million of sponsored research, philanthropy, training, and other grants. And supporting our developmental system for scientists is important. So shoring up our T32 programs for graduate students and our other P program awards for physician scientists has become a very focal point. And we were really excited to obtain the first award in the Commonwealth of an MSTP grant to help support our MD PhD program. And many of you are aware of that and involved in that and serve as mentors in that program. So really exciting development. Again, we were initially chartered through the state as we became part of the state system to be a premier metropolitan research university, but also a community engaged university. And often the university talks about the fact that we hold, as an R1, we hold those three statuses: community engaged, research, and with that community engagement, we now also have really a student success parameter with overall graduates from the University of Louisville earning greater than the median of their peers in the market. So I think we are showing that our graduates from the school, whether it be the undergraduate campus, the graduate school, or the professional schools, have really a great trajectory. And they are actually able to be gainfully employed. As a father of three daughters and some graduates of the U of L, I'm personally very grateful for that. And I think that's an important aspect of what we do. We obviously are building the $280 million new HSC building. That's taken on a huge amount of activity and effort, but I am happy to say that it's progressing quite nicely with the programming of the building being really mature at this point. We also have a situation where we have broken ground already and have infrastructure ready to go. So that's going to have science components with a reimagined core laboratory. It's going to have over a 64,000 square foot simulation center, which will be among the largest in the nation and will be integrated with not only our own health training ecosystem for competency-based, simulation-based training, but also to work with our community partners, especially U of L Healthcare and Norton Children's Group. So really proud of that. We also received a federal appropriation for a Center for Precision Medicine, and I think that is just a tremendous effort. And I am so grateful to Melissa Smith and Corey Watson in our Department of Biochemistry and Molecular Genetics, and to Dr. Gregg, who's present with us today, for considerable efforts that are going in that direction, which we believe is a direction that we can really make impact on, particularly for this region that has such a large chronic disease burden. Additionally, we were able to have the Green Heart Project from the Environment Institute highlighted in really national and international forums this year, which really is an earth-shaking type of treatment if you think about it. How often do we write a prescription for the entire population? And to be able to write a prescription in which there's a greening of spaces and show that there's decreased inflammation and inflammatory related chronic disease in neighborhoods is really a remarkable finding. Additionally, our neurosciences core has grown, and particularly with the recruitment of Dr. Damian Shin in anatomical sciences and neurobiology, and Dr. Adolfo Ramirez Zamora in the Department of Neurology as signature examples of where we are really harmonizing and growing a stronger and more capable activity in neurosciences. Additionally, around spinal cord research with KCERC, and there's been a great reimagining and amplification of KCERC's work, and we celebrated with Dr. Hubscher and Dr. Bierman this year the opening of a new pediatric KCERC center within the Fraser Institute, and that is going to be really a signature national and international facility, which we think will help it be sustainable in making impact in pediatric spinal cord disease well into the future. Additionally, the roles of training grants are increasingly important. The NIH CTRD and HRSA grants have allowed us to create an ecosystem that allows both faculty and learners to be engaged in more dedicated time for real research that leads to additional grants in meaningful areas for the research agenda for the University of Louisville. So a lot of emphasis on this Discover pillar, which is very important to us. I would really be remiss if I didn't think about our learners and really what they've done for us, because often our strongest asset has in fact been our learners. And I'm highlighting a few learners here who have been highlighted from everywhere from U of L Today to national media and beyond. Chelsea Fathour was one of our post-baccalaureate pre-medical students who was a nurse a mother of children, and decided she wanted to go back to medical school. And she did. She did, and she did, and she succeeded. And she beyond succeeded. If you can read in the fine print there, she actually matched in a residency in one of the most competitive specialties in the United States in dermatology. So very proud of Chelsea. Caitlin Shinneman was our Graduate Student Award overall for the university, the Guy Stevenson Award, and her work in the medical school. It was highlighted this year as just a dedicated and emerging strong scientist who we're very proud of. Sarah Belcher, another person in our MD PhD program who came out of our GEMS program. A non-traditional student, again, who came into the ecosystem and not only became part of our environment, but exceeded our expectations, exceeded her own expectations, and is thriving and doing great things. I'd like to say also in our residents and graduate students, like I said, I would love to have a story about every student we have, but that would be impossible for me to do in this brief time frame. But Andrew Ray, one of our second-year anesthesia, actually now third-year anesthesia residents, was elected to the Kentucky Medical Association board, showing that our students and learner population, a lot of times through Greater Louisville Medical Society and the KMA, are deeply engaged and are making a difference in advocacy, and their voice is a strong voice. And we've had exceptional mentorship on the part of our GLMS membership and our KMA membership in mentoring our students around advocacy. So something I'm very proud of. And then the last photo you see here is one of Bluegrass Biodesign, a novel program patterned after a somewhat similar program at Stanford University that's now several years in existence and growing. And this group of students was honored at the Innovations in Medical Education Conference, a very prestigious national conference this year. So you can see that our people, our learners, are making impact on not only the local and regional stage, but the national and international stage. I would be remiss to say if everything was always sunshine and roses. It's not. We do have challenges, and the challenges far exceed the list that I've enumerated here. But I did want to bring up a few of them, and I'm going to bring up one that's not on the list first, and that's the Web Improvement Project, because I have gone through various iterations of the stages of grief on that project. But I do want to tell you that we have had some recent progress that's quite good. We are about to conquer the directory problem and the ability to have faceted faculty directories that can be organized according to division or subspecialty specific areas in both the basic and the clinical science departments. So look for more to come over the month of August. It's critical that we get that website ready for the next recruitment cycle of residents and fellows, for the recruitment cycle of medical students, and for the recruitment cycle of graduate students. Even if we are using social media such as LinkedIn and avenues like that, the source material for much of that resides in our website. And the Web Improvement Project has been a vexing and difficult problem, a highly technical problem that's required the coordination and work of a lot of parts of the university. But new assets and new priorities have been placed on that area, and as I said, look for more to come. I think one of the things that keeps me awake at night is unmet financial need of students. We know with the Graduate Plus student loan limits now, that there are systemic challenges to borrowing. I think if I were to characterize this on the most recent 2026 report, which just came out a few weeks ago from the LCME, that's based basically on 2025 data, we know that the average graduating medical student debt is over $240,000. That places us above the 75th percentile for unmet financial need for LCME public medical schools. To give you some characterization of this, at UK, the amount is $220,000, so it's a full $20,000 shorter. So strategically, how are we going to deal with that? We're going to deal with that by trying to contain our cost. We have not elevated our tuition amounts for in-state students, but we have elevated it for out-of-state students modestly. Understand that when we increase tuition, that's not just an institutional decision. There are limits and rules placed around tuition and fees by the Council of Post-Secondary Education that we have to abide by because they're legislatively mandated. So we're always paying attention to that. So we'll try to contain costs to the learner. We'll try to make sure they have access to appropriate lending and financial counseling. That's part of the piece, and we're really doing a lot of work around that so our students aren't over borrowing when they don't need to be. But I think the largest effort that's going to occur in this as we begin to launch a philanthropic campaign, which will begin its silent phase, or what's called the nucleus phase, on July 1st, or actually on January 1st of this year. I'm sorry, excuse me. One of the leading institutional priorities is not just for undergraduate unmet financial need, but for unmet financial need across the spectrum of the learners at U of L. So we have to raise more dollars for scholarships. We have to give more scholarship dollars to our students. We are going to be less competitive in the market for professional students unless we are able to do that. And I would argue that the same goes for our graduate students, although the mechanisms are a little bit different. We're going to have to continue to keep stipends competitive with our regional R1 universities. And we're going to have to provide as much scholarship support for those students as we possibly can as we try to build a more robust research infrastructure. The expectation will be to have strong programs in that area. I'm really worried at times about the volatile funding environment. And I think if you think about that, I always talk about the fact that about 6% of the HSC budget and the School of Medicine's budget is based on general funds. The rest is non-general fund budget. So the sources of revenue coming into the school are very dependent on not only sponsored programs, which we talked about earlier, but especially clinical revenue. So maintaining strong relationships with our primary clinical partners, ostensibly U of L Healthcare, Norton Children's Hospital, the VA to a lesser extent, but increasingly regional entities that are out in the state, which I'm very happy to tell you that we've had considerable movement on. And I thank Dr. and Vice Dean In Kim, who's helped us work on developing stronger financial relationships and bonds with these regional rural hospitals, and also work through the Rural Health Transformation Fund that may amplify our revenue streams to the School of Medicine and HSC. So we do have to look at that very carefully. I think we will definitely be having to continue to think about position control, what was inaugurated as the hiring freeze or frost. I think we are trying to make sure that we're doing this more efficiently and effectively. We're entering an environment in which we will have to grow strategically rather than globally. And that we may have to have fiscal constraints in some areas. Those pressures are not going to go away. And a lot of those are related to the third bullet point here, which is healthcare uncertainties. With the One Big Beautiful Bill, we understand how Medicaid reimbursements are going to decrease beginning in 2028. So as a Medicaid expansion state with a university-directed program, we've had funding that has come up to from the Medicare rate of reimbursement to the average commercial rate of reimbursement. Starting in 28, over 5 years, that will decline back down to Medicare. So that is a multi-million-dollar declination in revenue to U of L Health alone. Now, obviously, there's a lot of things that we can do to approach that. We have not faced declines in federal reimbursement before. I often put the analogy of the Medicare program. We've always lived on that year-by-year cliff to make sure that reimbursement for physicians and hospital systems stays strong. I think we're entering a period of time where that's going to be the case for Medicaid as well. So there are still advocacy opportunities to amend, change, and think about the impact of Medicaid decreased revenues, but we also need to plan for them. Hope is not a strategy. Hoping that it'll go away is not a strategy. So we will have to continue to look at, as I said, growing where we need to strategically, but not globally, and also exercising efficiencies and constraints where necessary. I think also wellness challenges. We think about burnout in our community, not only of learners, but of staff and of our faculty. We were noted in one of our most recent not the most recent culture and climate study, but one of our previous evaluations of staff, to have a very high level of stress in the School of Medicine, but a much lower level of burnout. And that was a bit, I looked at those findings with a little quizzically, wondering how could that be possible? But I think what it shows you is you're living a little bit on a knife's edge. If that stress amount goes just a little bit of an increment higher, a little bit of a dose higher, when will we push the limits of hitting burnout? So we have to actively think about the wellness of our culture, the wellness of our population, and how that impacts not only ourselves, but our learners. So that will be a continued area of focus so we can keep a healthy and good work environment for all of the populations that are within us and that we serve. So additionally, I think it's increasingly difficult to support our faculty and staff to maintain high quality academics. So we need to market our academic programs. We need to shore them up and keep them strong. But we also need to, as sometimes was said by one of our former GME deans, John Roberts, we need to make sure we put the L back into learning. To make sure that we're supporting teaching and that we have funds flow mechanisms that support teaching. As we're working through, many of you know, at least the clinical chairs in the audience know, we're working through some physician comp reformation and revisions. Those are going to be very important that we're careful about it and that we're careful to honor and support our teaching mission. And I would let you know that I am going to be a strong advocate to make sure I keep our teaching strong. But that also requires us to be innovative and think about how do we do the best teaching we can in the environments that we exist in physically. And that's a challenge, but I've seen us meet that challenge before. At one point in time, for example, there were a lot of Medicaid-run clinics that were largely resident clinics and had, shall I say, a sparse attending presence. Now those have largely been integrated. We went through it. I think we improved the educational proposition, but we also improved billing compliance and ability to do things. So I know this is a smart group of people who will help me meet that challenge, and I definitely need your help because it's not something that I can move solely on my own. I want to talk a little bit about our future. And these are some strategic highlights. Again, I can't exhaustively go through our whole strategic plan, but I will pause here just for a minute to say this is not strategic planning of yesterday. This is not a dusty document that we're going to put up on some shelf. And this comes from the president down. In the future, in our future, near future, the here and now, the rubric that's going to be used to establish position relevance and position control, the one that's going to be used to make difficult budgetary decisions, is the lens of the strategic plan. So the overall university strategic plan and now the medical school strategic plan, which rolls up to the overall strategic plan, it's really important to get your input, because this is going to be a place where a lot of decisions are made. So it behooves us as leadership in departments, in centers and institutes, in service units to really pay attention to that strategic plan. One of the things that I've thought a lot about in terms of Learn is we're really at the precipice in terms of rankings of being a Tier 2 medical school. We're currently judged as a Tier 3 school, which most of the LCME schools are Tier 3. And those are schools that are 51 percentile up to about the 80th percentile, and those below are Tier 4. The Tier 2 schools are predominantly the research universities. So I think we really meet a lot of the statistics. We really want to think about it, not just from the standpoint of having a badge to put on our coat, with regards to U.S. News and World rankings or Bremer rankings, but we want to think about what the deep underlying meaning of those metrics are. One of them is student success, making sure that we get our students to pass their step ones, making sure that they have a good curricular experience, a meaningful community engaged learning experience. Those are some of the parameters that we have to think about in depth. And we have to think about that also looking like, feeling like, and serving the communities that we serve. So we got to prioritize getting those students so we are able to continue our mission of working on areas that have great health disparity, whether they be in urban Louisville or in rural Kentucky. in the Rural Health Transformation Project is one of the engines that may help us continue to meet some of that work. Recall that that program was also instituted by the One Big Beautiful Bill. It may not offset the greater declination of Medicaid revenues that was also put in that bill, but on the other hand, it's an opportunity, and the state of Kentucky received as much of an appropriation as the state of California, for example, about $231 million per year for 5 years, over $1 billion program. And through the hard work of many people like Dr. N. Kim, Vice Dean Kelly Bullard Dunn, we have put forth some really good and meaningful projects that will help us move the ball. And that's an area where I said we can have, while we're operating under fiscal constraints in some ways, we have some unique opportunities for growth and impact that we need to leverage ourselves to get behind. In Discover, we have several aspirational goals. Well, one is NCI designation, and one of that is, again, not to get the designation just for the sake of the name, but is to get the designation in order to make better impact. As Dr. Chesney often reminds me, we are the worst performer in cancer mortality in the nation, not something to be proud of. We now have our Brown Cancer Center downtown, but we have the nascent Brown Cancer Center at U of L Hospital South, which can lean into the rural cancer problem, both in terms of access and innovation. So look forward to working hard on that area, and it certainly helps support us as a R1 university that really wants to make a difference for this region. We're going to continue to want to enhance human studies and clinical and translational work, and hence the really renewed effort and emphasis being placed behind physician and scientist training. So we can take work from the bench to the bedside to make an impact on the chronic diseases that plague the Commonwealth of Kentucky. And increased interdisciplinary program grants and growth. So I would say it's often said that we are about 75% of the sponsored programs research of the University of Louisville in the School of Medicine. But I would say there's a better way to deliver that message. And the message that I would like us to use as our elevator pitch as members of the School of Medicine is to say we are the engine for interdisciplinary research at the University of Louisville. I think we, among a few other schools, have high levels of engagement with the Kent School of Social Work, the School of Music, Arts and Sciences, College of Arts and Sciences, the School of Engineering, which we're going to even enhance some of the work that we're doing with from now. So we work with many of our schools, and we promote interdisciplinary research. And we need to really fight that divide of thinking of Belknap and the HSC. We are one University of Louisville, and we are stronger together, amplifying the mission of all of those schools. In terms of connections, we are going to continue to work arduously to support Western Kentucky, which has been a large healthcare desert, both in terms of numbers of providers, access, and healthcare disparities. So that is an area of the state that we have close relationships and deep and enduring assets. The most recent of which is the establishment and the building of an internal medicine residency program in Paducah, Kentucky with Baptist Healthcare. That supports existing efforts and emphasis, such as our 23-year-old regional campus at Madisonville, our nursing school in Owensboro, our dental programs and dental hygiene programs in Owensboro and Paducah, our family medicine residency in Owensboro and Glasgow. So it's very important that we continue in that south and western aspect of the Kentucky to leverage ourselves to be a great asset for improvement of healthcare in those regions. I've talked a lot about the new health sciences building. It's not only a space for simulation, not only a new core laboratory, not only a new place for service centers such as mental health and physical health of our students, not only a broadened set of classrooms, not only a new home for the public health school, but think about it how it's going to transform community engagement. So our science pathway programs, our high school and middle school pathway programs, we can integrate that building into the planning a bigger tomorrow to garner healthcare interest and healthcare workforce interest among many students that are out in the state. And many of our offices, through work of really stellar work of people like Dwayne Compton, have built big and broad pathway programs. We need to strengthen those programs. I think if we think about our post-baccalaureate program too, which I see many of our folks who are from the OAE at the Health Science Center. Really powerful new tool for those offices to bring those students in and give them practical and simulation-based, competency-based education. We want to be an exciting place to learn, a compelling place to come, and especially for those students in areas that we really need more doctors. Our global footprint is not diminishing, but increasing. And many of you don't know, but we have people who are embedded in countries like Rochelle Holm in Malawi, doing work in public health and wastewater. And she has mentored a number of U of L students, both in public health and things as diverse as social work, and recently many medical students who have done work in global health. We have really been blessed to find out that we learn as much when we engage in global health as we teach or actually help. So the similarities of healthcare disparities in rural counties or urban areas of the United States are not markedly different than some under-resourced or third world countries. So being able to be engaged in this work is informative to improvements that we make not only internationally, but domestically. In terms of work, many of you saw the recent climate and culture survey, and there are a number of things that we need to address in that to build a stronger community for faculty and staff. I'd like to first say one of them is around safety and efficiency. So a lot of the work that's going up in LUMED is going to also improve wayfinding, the safety of pedestrian traffic, the green space on this campus, the ability of people to get outside and have lunch outside on a nice day. But people should feel safe on this campus too. So we are working on installing more cameras, more lighting, and having more effective systems for keeping the campus safe. And we're working with partners not only at LUMED, but beyond that with the city of Louisville and the university, our whole security service at the University of Louisville. So it's a very engaged effort. It obviously is incremental and it takes time to build that. But we do need to be an inviting place and a place where our learners, our staff, and our faculty feel safe. It should be a walkable environment every hour of the day. Additionally, I think one of the things that came up in the climate and culture survey that's important is the importance of shared governance and the why. When we're making decisions across the university, who have we included in those decisions? Who have we talked about, and how well have we communicated the why we're doing something, why we're opening something, why we're closing something, why we're expanding something, why we're contracting something. So we need to never forget the importance of that. I'm very proud of our faculty forum at the School of Medicine. It's been a deeply engaged group, and I appreciate the leadership of Michelle Stevenson, our Vice Dean of Faculty Affairs, who has a liaison and supporting leadership role with that. She's got an incredibly engaged group. My own personal leadership team, which has traditionally been vice deans. We've recently expanded to add 2 chairs, a basic science chair and a clinical chair, and I'm pleased to have Dr. Yes Hatab here and Dr. David Hine representing chairs in that leadership group. So we want to have more communication, more broad input for decision making, and I will make that affirmation to you that I'll continue to work seriously to enhance that. The president is additionally doing that, more open forums, more communication. We are going to have difficult decisions to make. We may not always have universal consensus around some of those decisions, but we should always seek input. We should always listen. We should always try to make the best decisions we can, and we should include our community as much as possible and always strengthen our communications. So if there are ways that we can continue to do that or do it better, you certainly have my ear because I want us to do that better. We've recently, for example, had around the position laddering, we had an open forum with Vice President Durrell here on the campus to talk about laddering and the merit-based system for compensation of staff and the new evaluation system. So we're going to try to increase that transparency and increase that engagement over time to make it stronger. So I thank you for allowing me to update you on a few aspects of the School of Medicine. As I said, I couldn't talk about everything. I didn't break out every detail. Certainly, there's a lot of complexities in our relationships with our healthcare systems, our state government, our federal government, and our community. But I'm happy to open the forum up for any questions that the group may have. And Tanya is going to let me know if there are any online questions or issues I could address or comments.
So to Bumpous, to give the overview, I'm working the trenches at the Brown Cancer Center, and I realize all the financial needs that the hospital. I have to put a plug-in for clinicians, nurse practitioners, as in fellows. There are no shortages in our ancillary services that makes it really hard for teaching faculty to have time to teach fellows. And it makes it hard for fellows because they have to put more orders in. So everybody is busy with busy work, but the learning comes a bit short. So how do we fix this?
Yeah, it's a great point, Getz. And I think too, when we start looking at things like challenges that the health system has faced, we start suddenly looking at our staffing model or how we're going to compensate nurse practitioners without always thinking about that educational aspect of what we do being important. And sometimes I think we made early decisions based on financial data without looking at some of the other consequences. So now we're recalibrating and kind of coming back from some pretty austere positions that we took. I think we have to be thoughtful. I think one of the things that worries me is, do we have the right people in the table at the table? Are we listening to the voices so we can understand some of those unintended consequences? I do have confidence, particularly with the U of L Health relationship now, having a physician in the leadership role, that we do have an academic physician in leadership who's over the health system. So I think that that is of primary concern of his. He has a lot of people putting bugs in his ears about different things, but I think having him there and having him advocate for the development of academic systems is going to be important. I think it's important that I stay involved in this and that I be a very persuasive spokesperson for maintaining the academic mission. And I look for better ways to do that all the time. And part of it is also for bringing other people in and having other people tell those important stories like you just told. We do have to do that. I see that as being cyclical. You know, again, if you're going to be just a WRVU driven enterprise, you're going to fail on the educational side. So it has to have some sense of balance to it. So I hope we're coming back to develop some sense of balance in that equation. Thank you for the question.
Thank you, Dean Bumpous, for the insightful update and your unwavering leadership. So the current era of healthcare and medicine particularly is going to be defined by the digital transformation and artificial intelligence. And I do know that the school as well as the university has made significant investments. Could you please expand on those and where you think the future is going to be as far as AI?
Thank you. Thank you very much, Dr. Hattab. So the question is around where we are with AI and advanced computing. And that's why you have smarter people than you when you're dean in the audience like Dr. Hattab. He's not planned it at all, but that was something that was glaringly absent from my talk, Iyas, and I appreciate you pointing it out. So when we think about, and when our president thinks about AI in the universe of the University of Louisville, and I expand that out to include all of our health science campus and health enterprise, we think about it in terms of enterprise management, clinical care, and research. And how are we amplifying that? And, obviously education. So one of the things that the president's cabinet and the provost have initiated is a program called Cardinal Intelligence. And Cardinal Intelligence is going to be the overall kind of moniker for all efforts AI. In the faculty forum, we established now a permanent committee for AI and advanced technologies, which is going to help advise the dean and also will be advisory to the representatives that go to the faculty senate on AI-related issues. That particularly is relevant to the development of educational programs. We want to create an environment that's not overly restrictive, so too concerned about the fact that students could use AI in an unethical or poor manner, but is sufficiently robust that they're actually taught to and encouraged to use AI. I think that's a very important thing. Certainly with research enterprise, with big data, multi-omic data, and integrating with large clinical databases, we're going to have more systems. So that's why we developed a new clinical and translational dean and chief scientific officer in the health system. We are developing a clinical trials management system, which will help with that integration of data and have made a considerable investment in that regard. So that's occurring. In the past few years, we have increased and need to continue to increase our investment in high-speed and advanced computing because we are in a larger data world that's going to have to embed AI algorithms. We have also, something you may be less aware of, there is the development of the Kentucky Center for Cybersecurity, or KCDI, and now AI. And we recently hired a new director for that unit. And that's going to be transformational because we are going to build up a level of security and integration that will allow us to compete for grants that we haven't been able to in the past because we haven't had the data security that we've been able to have. So considerable investment in our clinical trials management system to develop AI. Certainly one of the other two things, most of us are aware, and maybe you were or were not aware, so we're a Microsoft campus, and within our Microsoft suite is Copilot, but you can, unfortunately now it still requires an additional licensure cost, a institutional version of Copilot that is secure. I think that's particularly useful in enterprise management. It is less useful in clinical and research applications. But coming online this month will be the institutional version, which is open to all faculty and learners of Google Gemini. And with bringing on Google Gemini, there are many more educational components and capacity there, and more research component and capacity. So as we learn more about that, we'll be broadcasting that out to the departments, the faculty and learners, so they can do even more with that. I see David Ayler out here in the audience. I don't know, David, if you'd want to make a comment on kind of some of the emerging AI capacity and capabilities that we'll have.
I think that you explained it quite perfectly. I'll add Google Gemini. There is our Google investment also has a hybrid component to it. We'll have a very secure on-prem enclave for high performance computing, as well as the cloud environment, HIPAA and FERPA compliant. And the initial rollout of all this, as Dean Bumpous said, is sometime this month here in August. So it'll be available. The teaching and learning training is already going to start August 10th from the Delphi Center. And then there's more to come with the research side. So, yeah.
Yeah, and as we learn more of this, I think one of the things that has also always been limiting on this campus is we need to really develop the ability to bring some of these educational components and education about these systems to the departments. So we, in essence, a roadshow that allows us to engage at a departmental level, a little more local level, rather than making people have to spend their lunch hour with us or have to go to this campus or Belknap campus at an odd hour. So we'll try to bring more of those educational components to the department as much as we can. Tanya, I don't want to neglect anyone online. Any chat comments? Quiet community online today, huh? Very good. Any other comments or questions? Dr. Durrett, please.
Bringing up AI and looking at our hospital expansion of internal medicine in Western Kentucky, what is the university's role in, they're building that big data center in Paducah. And so that's in environmental health and advocating for some of those healthcare concerns, since we're going to be in that area. Are we in that conversation, or as a university in environmental health as well?
Yeah, thank you very much, Dr. Durrett. I appreciate that. Obviously, there are a couple of things I would say about that. One is, obviously we have to be pretty apolitical with our political neutrality statement. That does not mean that we can't have impact and have a voice in this. And for example, Ted Smith and others at the Environment Institute have been very effective of saying, no, we're not anti-data center. Yes, we are pro-environment. We need to figure out solutions that are helpful and not harmful to communities. So I think we can be a platform for dialogue around, is there a right way to do this and a wrong way to do this? And I think that's really at the essence of the academy. The university not only can do that, I feel like it's obligated to do that. We should be a place where we have those discussions and say, how do we, does it have to be an either or? Can it be, yes, we can do it, but we can do it safely and thoughtfully. We can engage with those communities and keep them informed, and we can make sure we're doing this the safest way possible. So I think that's the role of the university in general and the medical school. So you've seen a number of articles and events that have been promoted in U of L Today around this topic. Certainly as individuals, like many things across the world today, they're very evocative, but you obviously have your right to advocate individually for whatever your strongest feelings are on any particular issue or position. So our neutrality policy does not preclude individuals for having their individual voice, and I would never want people to ever think that. I do think we do need to be thoughtfully engaged with our communities. We need to be solution builders, and we need to be the place where safe conversations can occur. But thank you very much. That's an important topic and an important question. Thank you, Shori. Yeah, the essence of the question is around childcare and investments for the students, staff, and faculty of the School of Medicine, and is a very evocative, if not a bit of a sore subject, because of the financial exigencies that caused the closure of the Early Childhood Learning Center, or at least it's really not closed, but the devolution of financial support from the University of Louisville. So it's tough, and this is a huge community problem. I would say it's even amplified on the health science campus. Where can my child be safely taken care of while I'm at work and reliably be taken care of? I don't know that we have huge solutions, but I can tell you a few things that are encouraging. I think this is a place where we really need to delve into private and public partnership in an effective way. Where one entity can't afford to do it all, maybe more can do it. So, for example, some of the work that's occurring through LUMED right now is looking at more housing that includes child care facilities within the LUMED district. That's mixed-use housing that is affordable for populations like medical students, graduate students, et cetera. So definitely as a representative of the university on that board, I have been very seriously involved in conversations about planning around those types of entities. I think we also need to see who's out there in the market and doing that and making sure we're involved with those people and creating opportunities for our population. Our health systems need to be involved in doing that. Our university needs to be involved in doing that. I think it's going to be hard for any one of us to make the business pro forma work. So this is where many hands will make the lift lighter. So we need to look at consortiums of like-minded folks to build better, more enduring and sustainable solutions in childcare. It is a tough problem. Don't have an immediate answer, but I think we may have some long-term answers. Thank you for the question, whoever submitted that. Any others from online, Tanya? Okay. Other thoughts, questions? I'm getting the high sign from Mr. Giddings up there that I've got to get somewhere else. Thank you all for sharing your lunch hour with me, even though we didn't feed you. And I appreciate you being here. And please feel free to reach out to me anytime. I'm try to be very responsive in my emails to our community. So I encourage you to catch me as you see me walking down the hall or to shoot me an email at any time. Thank you.